Hello, and thank you for the opportunity to speak with you today. My name is Dr. Patrick Vink, and I'm the medical director at POP Healthcare. We are a provider of in-home primary care services in Arizona. Today, I want to take the opportunity and speak to you about the evolution of telehealth in our post-COVID world and the implications for it in assisted living facilities. Before we get started, I want to take this opportunity to thank all of you for the work that you do every day. Caring for our most vulnerable patients is an incredibly big responsibility, especially during this difficult time. And I'm very grateful for all the work that everyone is doing. Telehealth has been an incredibly important topic of late. And it really describes any time a technology is being used to help bring healthcare services to a patient. Wikipedia describes telehealth as the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and clinician contact, care, advice, reminders, education, intervention, monitoring, and remote admissions. That's an incredibly broad definition, and it speaks to how telehealth is being used in many different facets of medicine. Before we get into that, let's talk a little bit about where telehealth was being leveraged before the pandemic hit us. Well, telehealth was being adopted in very specific areas of medicine. There were some limited use cases in the primary care setting, also in urgent care type visits. There was some innovation being done around hospital stroke teams, where telemedicine was leveraged to serve rural communities, and neurologists could communicate directly with patients who were suspected of suffering from a stroke. There was also opportunities in the travel medicine space where patients traveling nationally and internationally had access to a provider to give them care if they were feeling ill during their travels. And perhaps one of the most important areas where telehealth was being leveraged was in the area of behavioral health. We've seen a lot of great examples, both from the VA and in other groups, where they were able to use telehealth technology to give access to care for patients in rural communities and help spread the availability of behavioral health providers. Prior to COVID, some solo providers had telehealth solutions. Certain provider groups had larger telehealth solutions where patients could contact their care team. And even insurance companies were leveraging telehealth as a service that was offered so that patients could get care quicker, so that they didn't have to leverage other resources like emergency rooms if it was avoidable. However, there are a number of challenges that really prevented the wide-scale adoption of this new technology. HIPAA concerns, licensing challenges between states, and even payment challenges with the use of the technology really limited how wide of an adoption we saw with this technology. And really, it was mainly an informal technology. So the vast majority of telehealth was conducted via phone call, text messages, emails, some video visits, and some of the other technologies we described above. But now we're really seeing this evolve. Now that the pandemic has hit us, the use of telehealth has changed dramatically. And really the most dramatic change is how much of an increase in adoption we've noticed. We've also seen big support come in from Medicare, Medicaid, large insurance payers, which have helped facilitate this adoption curve. Fundamentally, patients are more comfortable, and because of that, they're more willing to leverage these tools in order to get healthcare. We've noticed that this is helping us keep patients out of higher risk healthcare settings, which is incredibly important at this time. If we can provide care to them via telehealth and prevent them from getting exposure potentially in a higher risk area, that's a big win for the patient. Now there are a lot of different available platforms, and so it seems like there are many different apps and software solutions that different groups are leveraging in order to bring telehealth to the patient. Where I think this gets the most exciting is where this sets us up for the future. We're kind of at the earliest stages of where telehealth will take us in the coming 3, 5, and 10 years. But imagine where we can start to integrate other technologies and we can really start leveraging smart information with sensors, data tracking, and other new developments to help bring accurate, actionable information to our patients where they don't have to be right in front of us, but we can get information immediately and act on it. And we can help prevent things like falls. We can increase social engagement. And we can monitor the overall health of our patients without the every 1 or 3 month visit, which we typically see. So we're setting up for an incredibly bright future as this technology adoption continues. Despite all this excitement, what is not going to change? Well, in-person care is still vitally important. There's still many things that you can do and learn in an in-person visit that you're not able to do in telehealth. And in that sense, it's not going to go away. But telehealth will really continue to serve as a component of overall care. We might see specialty care still require in-person visits, but there still might be some use cases where a specialist can reach out to patients via telemedicine and accomplish important tasks without them having to come to the office. However, the procedures and interventions that specialists often do will certainly continue to require certain facilities. I'd like to transition to how could telehealth be a benefit in an assisted living center? Well, telehealth allows for efficient and quick access to a provider. It minimizes the impact of a visit on the patient. It prevents a potential exposure of a disease like COVID if a patient goes to a healthcare system. It saves the team and staff time from preparing and coordinating transportation to outside appointments. And it helps keep the resident at the facility as opposed to a long day away. We all know that doctor's visits can often take too long, especially when you include transportation to and from, and of course, dealing with the difficult weather that we often face in the summers in Arizona. So there are definitely times when leveraging telehealth will be a benefit to patients. But this definitely comes with its challenges. There are many different platforms that are being used, and that can be difficult for the end user and really the staff who are trying to connect the patient and the provider. It still requires staff time and staff utilization in order to get the technology to the patient and connect them. And that also requires advanced knowledge of who to contact and who to connect to. It's very likely that your patients are served by multiple different provider groups, or different patients have multiple physicians. And that really makes it harder to know which software and which platform to use. And of course, if patients don't accept this new technology and they prefer an in-person visit, that also will be a challenge to leveraging this new technology. But there are a lot of opportunities to help this succeed. I think what's so important, especially in this difficult time that we're all facing, is that we take a step back and remind ourselves that we're all sitting here focused on achieving one goal. And that goal is, how do we bring the best healthcare we can to the patients that we serve? And there will be times when telehealth is a great tool to use to help the patients in an assisted living facility. One really great tactic that we saw that has been incredibly beneficial to the patients is having a specific location within an assisted living center that is devoted to telehealth, where the equipment is there and the staff is trained on how to use it, and the patients feel comfortable going to that area. It is always important that we encourage our patients. And so that's encouraging them to be social, that's encouraging them to engage in their healthcare, and that's encouraging to leverage technologies. If we can begin to address the little complaints that the patient might have that they might be afraid to bring up on a telehealth visit, the goal is that by addressing those things quickly, we can help prevent them from getting more serious and leading to a more serious illness. And the use of this technology allows for that. It is time to start thinking about how can we modify staff workflows to support this change in order to make it easy for them to care for our patients, but also easy to use this type of technology. Another trick that could be useful is to have laminated cheat sheets where they have specific access to providers and which technology platform they're using. And at the end of the day, I think it's really important that we all take the time to collaborate and discuss what's working well and what's not. And I know that providers are going to be open to suggestions that you have that will help you in caring for these patients. So what does it take to have a successful telehealth program? Well, first off, it's important to decide on a technology platform. And so that means choosing iPads, laptops, or desktop type computers in order to facilitate the software. For the vast majority of telehealth software, it's either an app or some type of software download that is quite readily available. And they do a fairly good job in most circumstances of making it relatively easy to access the software that is required. That also requires the proper connection infrastructure. So that includes having the right Wi-Fi or data to be able to connect the devices to the provider. And that's an important consideration in a large building. Having the staff train and know how to adopt this technology is an important component so that everyone feels comfortable about when and how to leverage this technology. And over time, as we get better at these specific steps, we'll see improved patient care and improved patient satisfaction. And that's what we want at the end of the day. I took some time to put together some resources that will help describe where telehealth is being utilized in senior living centers. I've also shown some research that has been done which supports the use of telehealth in improving patient care. And so we know that there's research behind this type of intervention. And also CMS has put out a very helpful toolkit for telehealth as it relates to senior living in centers. And that's an incredibly important resource that I wanted to make sure that everyone has access to. I want to thank you all for this brief overview of telehealth technology. I also want to thank you for all the work that you continue to do to care for your patients. Please know that I'm available for follow-up questions, and my email is on this slide. If you have any further questions, please don't hesitate to reach out, and thank you so much.